We're just about to get ready for surgery on Muttley. We discovered that he's got a mass growing out of his gums, and we'll see that in just a minute. So what I'm doing right now is I'm getting ready for anesthesia. We're doing all kinds of things. We're giving him some medication to keep his heart going. We're getting his catheter in so he can get fluids and his antibiotics, and so we're preparing. So one of the things that we're going to be doing is we're going to be getting the drugs that we need to do, that we need to draw up rather, to anesthetize him. And vets have a big selection of different drugs that they can choose from depending on what they're going for, muscle relaxation or pain control or whatever. One of the things that I discovered doing all of the research for the cancer book that we're putting out is that some of these drugs are actually bad when we're looking at surgeries for cancer. And the thing that I discovered, which was an absolute shock, is that one of the drugs that we use, actually kind of a lot still in veterinary medicine and in dog surgeries, will increase the rate of spread after the surgery when we're doing tumor removals. That means that we remove the tumor and then all of a sudden find tumor cells cropping up in different places in the body very soon after the tumor, because one of the drugs, actually more than one, but one of the main drugs that we're using is causing the tumor to spread more rapidly than it would if we hadn't have used the drug. And here it is. I've got a little bottle of it right here. It's ketamine. This is something that we use really, really frequently in veterinary medicine. And I discovered a paper from the human literature that told us that if we use ketamine, the rate of tumor spread after surgery is actually much higher than it would be if we hadn't have used this drug. So from now on, I myself am not using this drug when we're doing any kind of surgery on tumors that look like they might be the kinds that will spread, because it has the potential to increase the rate of tumor spread. There's also some other agents too. Thiopental is another one. We don't use it very much anymore, but 10 years ago, 20 years ago, we used to use it. Which is an injectable drug, and another drug which is also not used very much is a gas called halothane, but those had similar effects. So I just wanted to let you know, and this would be a good thing for any dog owners who are going in for cancer surgeries to check with their vet on, just to make sure that they're aware of this, because it's something that actually a lot of vets aren't aware of. I myself wasn't aware of it until I started doing these hours and hours and days and months and years of research on this stuff, and I just wanted to let everybody know.